When we have had conversations with the president, he's been very clear that our goal is not to build a new thing, as awesome as that will be. And this new thing will be data that's accessible to any of the researchers and folks that want to use it. It'll be secure, but accessible to people to use. But our goal is to also attack the underlying frictions that make this work hard. Yep. One of the frictions that we identified early on and that he dramatically reinforced is the innovative potential of individual human beings with their own data in their own hands. Mm-hmm. And I would like to lay out 3 places where we are both innovating on that, and I think there's an opportunity for others to innovate. One is, what if participating in a research study was as easy as connecting an API using an API in OAuth, right?
Absolutely. Sounds good.
So we see this in ResearchKit that now you can sign up for a research app, and we are working with 7 EHR vendors to enable the APIs that they're building to be a conduit for participation in research into the PMI. So that's one, making research participation as easy as connecting an API. Second, what better way to enable future uses of research than to put the data in the person's hands? But yet we know in most research studies you don't get any of your own data back. The national survey that was run by the NIH Foundation found that 80% of people surveyed would be motivated to participate in research. Now let's remember, 3% of cancer patients are in trials. 80% would be motivated if they could get their own data back. Last, we have an ethics of protection. It's the IRB, it's the common rule, and it's super important. What about an ethics? What about a manifesto of participation? So what if I said as a patient, I'm not signing up for your study unless you promise to abide by this manifesto? And here it could look like this. It could say, I want my results back, I want you to publish an open access journal, and I want you to release the identified data. So if we took this motivation, we still have to deal with like how to connect those pieces, but what if we had a manifesto of participation? Because nothing is more insulting to somebody who's spending their blood, sweat, and tears literally on research than to know it got siloed into an individual researcher's data bank. So I think we have an opportunity to use participants and patients as vectors for this kind of acceleration.